Well, regardless, I just want to let you know that you're doing really good as far as being proactive. So just keep up the good work, and just keep going to see your psychiatrist, taking your medications, coming and just letting me know what's going on to see how we can both better help yourself.
Mm-hmm.
So just to touch on the little things. As far as having schizophrenia, I know you mentioned previously that you used to hear voices, but it wasn't something that you really thought of talking about with someone until most recently. I do know that with having schizophrenia, you have your good moments and you have your bad moments, and I say that all with a grain of salt. Your good moments could be considered things such as like your hallucinations or your delusions and just hearing those voices, and I say good because that's kind of like a high moment that you have. Mm-hmm. Where you're just it's euphoric, you're kind of hearing these things, you can't really tell the difference between reality and what's not, and then you also have the down to that, which would be having depression, wanting to just be in the house all day, not really wanting to go out, not really wanting to eat or sleeping too much and things mm-hmm. like that. So just being aware of those things, and then seeing if you see a pattern and say, hey, like I said, just letting your psychiatrist know, letting me know what's going on, so we can kind of see if we maybe need to change your medication or just try a new activity to kind of help you not feel bad whenever you have your bad days. Mm-hmm. As far as assessments, I would recommend revisiting your DID. So what your DID stands for is Determination of Intellectual Developmental Disability. And so since the people I work with have intellectual disabilities, that does vary from time to time. So again, touching on what you said recently, you heard voices, you didn't really pay much attention until now. The reason I want to revisit that is because maybe there's something that has changed. Maybe something happened within your environment that just kind of sparked something that you had dormant inside to arise, and now we just have this other fun thing we have to, just kind of work with. So that's something that I would want to just kind of retouch is your DID assessment. And then as far as treatment, I think it would be really helpful to just retouch some of your services. So I think it would be really good to retouch adaptive aids. And so with your adaptive aid service, essentially that is anything that we can give you to make your life a little easier. So since you previously mentioned that with the medication you were shaking a lot, we can't really control what the medication does, and I know you do have to take it for a certain amount of period to see how effective it is and how how reoccurring you get certain symptoms, like the heightened of your you shaking. Mm-hmm. And so I feel like it would be really helpful that during that time that you use something called weighted silverware. And so basically it's silverware that you use that has weights on them, and so whenever you're shaking, it gives you the ability to still be autonomous and being able to eat, not feeling bad that you're shaking, you have this uncontrollable mm-hmm. shaking, but it also just it helps you kind of bring back that independence despite what's going on. So mm-hmm. I think that'd be something really helpful. Is that something that you would maybe want to try out?
Yeah, that sounds fun.
Awesome. You'd be the first one to try it out too.
Sounds really fun.
You'll have to let me know how that feels. Another thing I'd like to do is just really focus on your transportation and make sure you have a really secure, independent assistant or people that will work with you as far as taking you to your appointments. I think at this point, it's very important that you go to every appointment that you need, whether if that's dentist, the psychiatrist, whichever. Just having that consistency and making sure that you can meet each of those doctors, so they can help you on that mm-hmm. kind of end. I think we should also work on behavioral support. I know you said that your behavior has changed as far as wanting to sleep more, not really just kind of feeling laid back and wanting to stay home, not really wanting to do stuff, and just basically making sure that we have a nurse or someone kind of come out and see how you're doing, monitor your behavior. If you've seen, I know you previously mentioned that whenever you were at Mayhill that they had to sedate you, and so kind of just monitoring that behavioral aspect. And then lastly, retouching on your CFC. And so CFC stands for Community First Commitment. And so what that is where we have, again, attendants who, you may not want to go out, but say that you get an urge to want to go see a movie, or that, you want to go swimming, or whatever you want to do, just to have that social support. If for whatever reason, if you want to go, get something to eat, just anything that takes you out of the home, you have that consistent support where you can say, oh, I want to go do something, and you can go do that, because I know sometimes your mom can't help you, or you may not have the means of transportation, or whatever the case is, so you have that there to your, to your service. But other than that, Sam, I just, I thank you for coming back. I know you've been going through a lot of stuff, and like I said, I'm here. If you need anything, feel free to reach out to me. Let me know if you have any questions or concerns. But other than that, we're all good for this meeting. Do you have any other questions for me?
No. When's the next time I see you, I guess?
Well, we'll schedule that in a minute. All right, thanks.